We're really grateful to all of the patients, their carers and their families for the support that they've given us that has allowed us to take part in the 3rd National Patient Experience Survey. This is a really important piece of work that allows us to engage directly with patients to find out what they think of the services that we're providing. We're also very grateful to our own staff because our staff support patients in contributing to this survey and encourage them to do so. In the past, what we have seen is that 80% of the patients that have used our services have expressed high levels of satisfaction with the care that they have received. And while that is very important to us and we can really learn from that, it is also important for us to note that at times our services do not meet with patients' requirements, and therefore we must also learn from that and try to make things better where we can. Our commitment is to do exactly that and to learn from what is both good and what is bad within our services. We also use the Patient Experience Survey to learn between sites. So when we see something working well in one location, we try to transfer that to other locations as well. As a result of previous surveys, we've introduced a number of initiatives that help us to interact more effectively with patients. So for example, we have patient liaison officers on most of our sites at this stage. We've also introduced the Butterfly scheme to help us interact more effectively with patients with dementia. And we also have the PJ paralysis scheme, which helps us to ensure that patients are up and active while they're with us in the hospital. And all of these initiatives have come out of the information that we've gotten from previous surveys. So again, I want to thank patients, their families and indeed their carers and our own staff for your contribution to this survey and for helping us to get this very important information that ultimately will help us to improve our services.